In dark times, people seek the light, the burning ember of a winter sun on the horizon, and hills to climb in search of perspective. A year after the first case of COVID-19 was reported in the United Kingdom, more than 100,000 people have now died of it. Hundreds more follow in their footsteps every day, slipping from view and leaving in their wake sorrow and grief and questions that won't go away.
So we head over to a virtual leader of the opposition, Right Honourable Keir Starmer.
Thank you, Mr. Speaker. I'm sure the Prime Minister regrets the fact that 100,000 people have lost their lives. The question is why? Why has the United Kingdom a death rate that's higher than almost anywhere in the world?
This was Boris Johnson taking questions in the British Parliament last week.
There will indeed be a time when we must learn the lessons of what has happened, reflect on them and prepare, Mr. Speaker. I don't think that moment is now when we are in the throes of fighting this wave of the new variant.
For his critics, though, it is precisely Johnson's failure to learn from his missteps in the spring that has led to an even more devastating fall and now winter.
With the first lockdown, everything got shut and then everything was open again. And then the virus spread it again.
Street artist Nathan Bowen is braving lockdown fines to paint a mural in the middle of London. Providing people with a little hope in bleak times, he says, is essential. So we're saying thank you.
The paramedics do the hardest job. They're the ones that deliver the patients. So I think it's important to, put them up on the street.
London ambulances have become ubiquitous in the capital, pacing the streets and delivering fragile cargo to waiting hospitals and care workers at breaking point. There were about 18,000 people in hospitals with COVID-19 over Christmas. Just over a month later, there are more than 30,000.
The numbers that we're seeing of death and people dying is something that I don't think anybody can really fully grasp. Yeah.
We first met Canadian acute medicine doctor Hanomansing last spring when she was dealing with the first wave of COVID-19 patients in the UK. It was hard enough then, she says. This time, the number in hospital is nearly double that, leaving many facilities short-staffed and struggling to find room for patients.
We were having to triage them outside in the parking lot. We just did not have the capacity to actually see them in the hospital.
Sandhu had hoped there might be more support for the National Health Service after the first wave, especially after the Prime Minister succumbed to the virus. Here he is clapping for healthcare workers just before being taken to hospital himself. Now, says Sandhu, many healthcare workers simply feel taken for granted by a government that hasn't done its homework.
And the timing of the lockdown is reflective of that, where our doctors and scientists were saying, no, these restrictions need to come in sooner, and they didn't. So I think that speaks for itself in a way.
Johnson waited until January 4th to impose the latest lockdown here, despite weeks of warnings from his own experts. Earlier in September, he also resisted their advice when they called for a circuit break to curb rising infections after a summer when the government opened travel corridors to other countries and encouraged people to eat out to help out the economy. Asked in Parliament why UK infections were still higher than in other European countries, Johnson replied that Britain is simply more freedom-loving.
Virtually every advance from free speech to democracy has come from this country, and it is very difficult to ask the British population uniformly to obey guidelines in the way that it is necessary.
It hasn't helped with the messaging, already confused. And critics say Johnson's British exceptionalism has consistently undermined efforts to fight the pandemic. David King is a former chief scientific advisor for Britain.
It's a problem of leadership, and I'm quite convinced that if an alternative leader was in place, it could be Theresa May, could be the present leader of the opposition, we wouldn't be in the situation we're in now.
The government argues that the reason things have spun so badly out of control in recent months is because of the detection in early December of a new, more contagious strain of the virus. King insists it doesn't let the government off the hook.
We really gave that new mutant a big boost by having that Christmas break. People traveling all around the country was just the best thing to do to spread a new virus. And now, of course, it's right across the United Kingdom.
There is, though, hope on the horizon. You'll find a piece of it at Salisbury Cathedral. Vaccinations by lamplight and organ music. One of the venues the NHS has commandeered to deliver vaccines the government gambled on back in the spring. 9 million people have now been given their shots, putting Britain in the top 3 of vaccinating countries, and offering a potential saving grace for Johnson, according to Conservative MP and former Health Minister Jeremy Hunt, who admits there have been plenty of mistakes.
But I also think history will factor in the fact that Britain has been the most successful large country when it comes to the vaccine rollout, and that may well save many lives during the course of this year. And so I think from the government's point of view, they will point to that as well as being a very important part of our overall response.
The success of the vaccination program, relying on the NHS and local health authorities, contrasts with Johnson's failure to deliver what he said would be a world-beating test, trace and isolate system. The government paid millions of pounds to private companies with no healthcare experience, and it's still struggling today.
This is the single biggest flaw in our pandemic handling strategy at the moment, that we have this huge number of people who are asked to self-isolate every week because they've been near someone who's got COVID, and they're not. And a lot of them are actually going to work. It's about 240,000 people every week.
The potential for the virus to mutate beyond the reach of the current batch of vaccines is also of real concern, as are fears that people suffering lockdown fatigue will see the vaccine as a reason to let go. There is already a sense here of lockdown light compared to the first one, even though the numbers are so much higher and the pressure on the NHS so much greater.
You feel angry, you feel upset, because like I said, we're still showing up to work every day and we're seeing the numbers and we're seeing the effects that this is having on patients and their families.
It increases the sense of distance here between those confronting the daily reality of the fight against the pandemic in the hospitals and in the morgues, and those on the other side of the curtain, where the sheer volume of the daily death count can serve to numb and render faceless all those who've passed. If ever there were a time for lessons learned, this is surely it. Margaret Evans, CBC News, London.